Welcome to this video on bladder cancer. Bladder cancer is a disease in which abnormal cells grow uncontrollably in the bladder, the organ that stores urine. In this video, we'll explore what bladder cancer is, its causes, how it affects the body, how it's diagnosed and treated, and what can be done to prevent it. The exact cause of bladder cancer isn't fully understood, but several risk factors have been identified. The most significant risk factor is smoking. Tobacco smoke contains carcinogens that are filtered by the kidneys and concentrated in the urine, directly exposing the bladder lining to these harmful substances. Other risk factors include exposure to certain industrial chemicals, such as aromatic amines used in the dye, rubber, and leather industries. Chronic bladder infections, bladder stones, and parasitic infections like schistosomiasis can also increase the risk. Furthermore, a family history of bladder cancer may suggest a genetic predisposition. Bladder cancer typically begins in the urothelial cells that line the inside of the bladder. When these cells are exposed to carcinogens or other factors, they can undergo genetic mutations that cause them to grow and divide abnormally. These abnormal cells can form tumors on the bladder wall. These tumors can be either non-invasive, meaning they remain on the inner lining, or invasive, meaning they grow into the deeper layers of the bladder wall and potentially spread to nearby lymph nodes and other organs through the bloodstream or lymphatic system. The tumor's growth disrupts normal bladder function, leading to various symptoms. Understanding this process is crucial for effective diagnosis and treatment. Bladder cancer is a significant health concern globally. It is the 10th most common cancer worldwide, with men being more likely to develop the disease than women. The incidence of bladder cancer tends to increase with age, with most cases diagnosed in people over the age of 55. Geographical variations in incidence rates exist, often related to regional smoking habits and exposure to industrial chemicals. Understanding the epidemiology of bladder cancer helps in identifying high-risk populations and implementing targeted prevention strategies. The symptoms of bladder cancer can vary depending on the stage and location of the tumor. The most common symptom is hematuria, or blood in the urine, which can be visible or only detectable through a urine test. Other symptoms may include frequent urination, painful urination, a feeling of urgency to urinate even when the bladder is not full, and lower back pain. Advanced stages of bladder cancer may present with symptoms like pelvic pain, bone pain, swelling in the legs, and unexplained weight loss. If you experience any of these symptoms, it is crucial to consult a doctor for proper evaluation. Diagnosing bladder cancer typically involves a combination of tests and procedures. The first step is often a urine test to check for blood or cancer cells. A cystoscopy, where a thin, flexible tube with a camera is inserted into the bladder, allows the doctor to visualize the bladder lining and identify any abnormalities. If suspicious areas are found, a biopsy is performed, where a small tissue sample is taken, examined under a microscope to confirm the presence of cancer cells. Imaging tests such as CT scans, MRI scans, and ultrasounds can help determine the extent of the cancer and whether it has spread to other parts of the body. Bladder cancer is classified based on several factors, including the type of cells involved, the stage of the cancer, and the grade of the cancer. The most common type is urothelial carcinoma, also known as transitional cell carcinoma. The stage refers to the extent to which the cancer has spread, from stage 0, which is confined to the inner lining of the bladder, to stage IV, which indicates that the cancer has spread to distant organs. The grade describes how abnormal the cancer cells look under a microscope, with higher grades indicating more aggressive cancer. Non-muscle invasive bladder cancer and MIBC, and muscle invasive bladder cancer MBC are the two broad categories based on whether the cancer has invaded the muscle layer of the bladder wall. Treatment for bladder cancer depends on the stage, grade, and type of cancer, as well as the patient's overall health. Treatment options may include surgery, such as transurethral resection of bladder tumor, or TURBT, which removes the tumor through the urethra; cystectomy, which involves removing all or part of the bladder; chemotherapy, which uses drugs to kill cancer cells; radiation therapy, which uses high-energy rays to destroy cancer cells; and immunotherapy, which helps the body's immune system fight cancer. In some cases, a combination of these treatments may be used. Intravesical therapy, which involves delivering medication directly into the bladder, is often used for non-muscle invasive bladder cancer. While there is no guaranteed way to prevent bladder cancer, certain lifestyle modifications can reduce your risk. The most important is to avoid smoking. If you smoke, quitting is the best thing you can do for your health. Reducing exposure to industrial chemicals, staying hydrated, and maintaining a healthy diet can also help lower your risk. Regular check-ups and screening for bladder cancer may be recommended for people at high risk, such as those with a family history of the disease or those who have been exposed to certain chemicals. The prognosis for bladder cancer varies depending on the stage and grade of the cancer, as well as the treatment received. Early detection and treatment can significantly improve outcomes. The 5-year survival rate for bladder cancer is generally good, especially for non-muscle invasive bladder cancer. However, the prognosis is less favorable for more advanced stages of the disease. Ongoing research is focused on developing new and more effective treatments for bladder cancer, including targeted therapies and immunotherapies. Recent advances in genomic sequencing are also helping researchers understand the genetic mutations that drive bladder cancer, paving the way for personalized treatment approaches. Regular monitoring and follow-up care are essential for people who have been treated for bladder cancer.